Sina, is this an annual event that you all do typically every year, or I think you're on mute.
This is actually the first year that we've done it, and we actually planned it last year, and we had a lot going on, but COVID kind of forced us to cancel, and we worked, a lot to kind of get it through now into this um, like video format and stuff. So yeah, this is the first year, and we hope to make it an annual thing.
Cool, very cool.
And if I recall, Zaina, it's like kind of student driven, student led. You all are.
Yes, we're all undergraduate students.
I have to give you a lot of credit. You have communicated more than most most other event leaders. So you've done a great job with that.
Thank you. I would owe that to our co-chairs. They've worked really, really hard into making sure everybody gets the information and everybody's able to, be here today.
Well, I'm glad we gave you that that motivation. Well, it looks like it's 10 on the dot.
All right, guys, it looks like it's 10, so it's, I guess our official time to start. I think people are gonna continue coming in, and that's perfectly fine. They can join whenever. So thank you guys for attending the Iowa State Pre-Health Conference. My name is Zaina, and I'm one of the PT outreach chairs. If you're here right now, you guys are in the physical therapy health professionals panel. And if it's not the Zoom you wanted to join, check our website, which to find the appropriate room. So this is how we're going to run today. I'm going to have our professionals introduce themselves by stating their educational backgrounds and where they work and their specialties. And after introductions, I'll ask our questions and have them answer. And then I'll also take a look at the student questions from the Q&A chat. So students, if you have any questions, you can insert them there and also upvote the ones that you'd like to be answered. So to start out, I'd like to ask Dr. Lisa Dan Miller to introduce herself.
Sure. Thanks for having us, Zena, and thanks students for joining. We think even if you're in the wrong room, you should stay here. I'm Lisa Dana Miller. I'm an associate professor at the University of Colorado in Aurora, Colorado. It's the Anschutz Medical Campus. And I am also the chair of the recruitment and admissions committee for our program. I'm a pediatric physical therapist. I've been doing work in pediatrics for most of my life. So thank you for letting us join you.
All right, and then next we have Dr. Adam Yoder.
Hi, everyone. It's good to be here. My name is Adam Yoder, as Zena said, and I'm a associate professor at Allen College in Waterloo. We're a new developing program. And my area kind of interest is in orthopedics and manual therapy. I'm also an athletic trainer, so sports medicine. Those are kind of the areas that I focus in, and I'm also the faculty admissions coordinator for our program as well. So it's good to be here.
All right, and then our last panelist for today is Dr. Sarah Burns.
Hi guys, I am a physical therapist in Central Iowa. I work for Mary Greeley Medical Center, and I work at their smaller satellite clinic in Story City, so it's more of a rural health setting. I am a newer graduate, so I've been out for about 2 years. So if you have any specific questions about that, I'm happy to answer. I went to the University of Iowa for physical therapy school, and I'm now one of their Central Iowa representatives. Yeah.
All right, so I guess we could start the questions for today. So our first question for today is, I guess we'll start out easy. What part of your career do you enjoy the most? And then if you guys would like, I can, if Dr. Lisa could start us out for today.
Sure. Thank you, Zena. It's a hard decision because I enjoy a lot of it, but I will say the children and families that I work with at Children's Hospital, I still get to do a little bit of work. I mostly teach, so that's a hard choice between teaching in the what we call our neuro track. I really enjoy sharing my kind of years of experience with students as well. So I'm going to give 2 answers. Those are my 2: the children and families, and then sharing experience with students.
I can go ahead and go. Yeah, I would there's a lot to enjoy about our career. I think one of the biggest things for me is that physical therapy is a profession where you're continuously learning. That's kind of one reason I kind of have found a path in academics, because I really feel like you really learn a lot by teaching. And the focus is really on, helping students kind of achieve their goals and learn. So I really enjoy that aspect. And then I also really enjoy kind of bringing the clinical side to the classroom. So being involved personally in the clinic and being able to treat patients and kind of bring that into the classroom is something that I enjoy. I mean, there's many other things, but I'll stop there with those.
I agree. There's a lot of awesome things about the profession. I'd say that I like how patient-centered physical therapy is. We get to work with all sorts of people with all sorts of goals, and we really specify our treatment for what they want to accomplish. And we get to spend a lot of time with our patients too. That's a very unique thing about this part of healthcare. A doctor's visit is usually a quick 15, 20-minute appointment every few months or once a year. We get to spend 30, 40, 50 minutes with our patients multiple times a week. So we really get to know them and get to know them personally.
All right. I guess our next question is, I'll add two, including the one we have sent through the Q&A, is how much of a time commitment is your work, and how much time do you spend outside doing paperwork, notes, or like, stuff that has to do with like your work?
May defer to Sarah or Adam on this. I do one clinic a week, and so the amount of time I spend is probably not necessarily reflective of what a full-time physical therapist does.
I can talk on this one. So I work full-time, 40 hours a week at my clinic. There are days that I stay after maybe a half an hour or an hour to catch up on paperwork. There are other days that I have some cancels and I have extra time throughout the day to get all that done. So maybe a little more than 40 hours now that I'm a few years into my career. That was definitely a lot more at the beginning of my career, because I would go home and do some research on different cases or different diagnoses that I knew I had the next day, or treatment techniques that I wanted to try. So it was a little bit more preparation for the next day. And then I was just slower at paperwork. So I think I have a good situation right now where I don't have a lot of productivity standards. So my hours are pretty close to the standard 40.
Yeah, I would just add, from my personal experience, it just kind of, it can fluctuate a little bit day to day, depending on how busy you are. If you have a new patient and evaluation, that paperwork can take a little bit longer than if you're seeing a reoccurring patient that's coming back in. Typically, most of the time, depending on your setting, those notes can kind of be completed as you're seeing the patient. And as Sarah mentioned, I think as you have more experience, as you do it, you become a little bit more efficient, and then you get into kind of a flow of when you can get your notes in, how long it's going to take, and hopefully, like Sarah mentioned, it's not taking you an hour every day at the end of your day, 2 hours to complete notes. If that's the case, then maybe you're really busy, or the documentation system is maybe not ideal. But I would just typically say maybe 30 minutes after your day, something like that might be sort of average.
Okay, so our next question is, in what ways has the pandemic affected your job and your like experience with patients? And then if I guess we could also again start out with Dr. Lisa.
Yeah, I mean, I think most of us, many of us have had to do some transition to telehealth, and so that is something that I think was a learning curve for some people, and some people were already kind of prepared and had done that. So I think the pandemic has really demanded creativity from most of us. How do we work with a person that we can see through a camera when we're used to having our hands on? So that has been a challenge, and actually kind of a good challenge for most of us, because telehealth will probably be something that will continue on as you know, from now on. So we'll still be doing our hands-on type work, but telehealth will be an option for people who may live in rural communities, may have difficulty with transportation, all of those kinds of things. So it's really good that we now all have that. I think all have that as an option.
Sarah may have a little more recent experience with this. I would just say, you know, there's been a lot of extra safety measures that have gone into place, seeing patients in the clinic, masks and cleaning and social distancing as much as possible. But you know, patients do seem to be coming in. The clinic I work at is busy, and so, you know, I don't think for me personally, it's necessarily affected, um, you know, job status or anything like that. It's still patients are still coming in. They still need care. So just a lot of extra safety measures have been put in place. And like Lisa mentioned, I think having telehealth as an option is an excellent option to have. To be able to still touch base, communicate with patients without, you know, risk for exposure.
I agree with both of those. We've done a lot more cleaning, a lot more time with those safety measures that Adam was talking about. And then I've definitely treated some telehealth also. Early on in the pandemic, we slowed down quite a bit. I think the fear level was pretty high right at the beginning. And so we had a lot of people that just decided to stay home or switch to telehealth. But then as the months went on, people just got more comfortable with it. And so they did come back. They're comfortable with the safety measures that we put in place, and we make sure to tell them about all of that kind of when they come in for their first visit, that these are the things that we're doing to keep you and us safe. Because of my unique position being associated with a hospital, I actually got pulled down to help at the hospital during some of the surge levels as well. So I was cross-trained in acute care. So I did a little bit of work in the hospital as well, not working directly with the COVID patients, but working with everybody else that was in the hospital, so that the acute care therapists that work there could spend time, extra time that they needed with the COVID positive patients. The only other thing I was going to mention is that I think another big part of, it's just something I've had to do a lot of, is education with my patients as they come in about the coronavirus and about the vaccine and things like that, because we might be the only healthcare provider that they've talked to in a while. And so they have questions and misunderstandings of the virus. And so staying up to date on some of the latest information so that you can relay that to your patients is something we've had to do at our clinic.
All right, thank you for that. I'm sure the pandemic has given us all new challenges. So for the next question, the $1 million question is, why did you choose this health field, and why did you decide to go into healthcare? And then I could switch it up. Could we have Dr. Adam please start us out?
Yeah, that's a good question. I think everybody has kind of a different story, a little bit of why they got into it. I just growing up, I was always kind of interested, high school in biology and the human body. It's always kind of a subject that I was kind of interested in. Then when I went into college, I majored in athletic training, so I was still kind of had that focus of interested in the body, interested in kind of how the body performs and injuries. And when I was in the athletic training program, we had a physical therapist that would come over once a week, and he would treat some of the athletes, and he would do kind of some hands-on techniques, and patients would get up and they'd feel better kind of immediately, and so I was always kind of interested in that, and he was a physical therapist, so I kind of it kind of shaped my area of interest, and decided to go into physical therapy, and also along what I really liked and what Sarah had mentioned earlier was being able to spend time with patients to see patients kind of reach those goals. Some of the other providers spend a small amount of time with patients, and they don't get to see sort of the change over time, kind of as we do. So those are really the main reasons how I got into physical therapy.
I can go next. So I have probably more of a classic way of getting into physical therapy, and that's through like youth sports that I was participating in. I was a gymnast for a really long time, and I didn't have that many injuries, but I had a lot of teammates that were strong, healthy, doing crazy flips and things, and then all of a sudden they'd be injured and they couldn't do anything. And they'd go to this magical place called physical therapy, and they'd have these exercises to do at the gym for the next few weeks. And then suddenly they could do all of those crazy flips again. And I was just fascinated by that process. And so the few times I was in physical therapy, I would ask a million questions. And that kind of jump-started my interest in the field. The more I learned about it, the more I became even more fascinated with it. And learning about how broad physical therapy is, it's not just sports and athletics that you deal with. It's so much bigger than that. And so the more I learned, the more I was hooked.
Yeah, and I think I was probably a little more similar to Adam in that I was always fascinated by I had one of those the invisible body kind of things when I was a kid, and those kind of things always interested me. And then I worked in a nursing home when I was in my first couple of years of college, or actually before college, and I felt I know they're called skilled nursing facilities, but I was just fascinated by watching people make improvements and realized that I didn't get to see their work in PT at that point. But when I was in college, I was thinking I wanted to go to med school, and I started volunteering at a VA hospital near the campus, and I watched a lot of at that point I was mostly seeing veterans who were being treated, male veterans, um, and I fell in love with the physical therapist's work that I was watching, and decided instead of med school, I really loved this world of physical therapy, but it was pretty new to me, and so my interest in pediatrics was when I was in PT school. I watched my instructor do some work with a child, kind of like Adam, like this child changed really quickly. And I was just stopped and went, I want to do that. I really want to do that. So that kind of directed me towards pediatrics, where I've been most of my life.
All right. I wanted to direct one of our questions, our live questions, to Dr. Sarah. One of the students asked, "Do you have any advice on how to stand out as a pre-PT in like applications and interviews?"
Sure. There's lots of ways. I think one of the things that Iowa really appreciated about their candidates were having a wide variety of knowledge about the field and having a wide variety of different observation experiences. I know that's really hard right now because not many places are accepting that. But they want to know that you've done your research. You know that physical therapy is a field that you want to be in, because it is a lot of schooling. It's a big commitment, and they want to make sure you've kind of vetted through other options. So, and just care about the field and know enough about it. So that's one thing that they've said that I think a lot of schools probably look at, is just that you know the field and you know that it's the field for you. Yeah, that's the main thing that stands out. Otherwise, just preparation. You don't want to go into an interview unprepared. So do your research and speak just from your personal experiences, and don't try to have the perfect answer. There isn't one.
All right. And then also, I guess another live question was this is to all of our panelists, is during your career, have there been any changes in terms of how to treat a patient towards a specific injury? As in, have you found better techniques on your own based on like new articles or new studies that have come up?
I think Adam already spoke to this. This is a field that is constantly changing and improving, and you have to be a lifelong learner. I've been this past year was my 40th year as a physical therapist, and I think it's just phenomenal that anybody can be in one profession, you know, and love it for that long. I feel very grateful. So what I would say is that yes, we have the world of physical therapy research has increased tremendously over the years. It's much higher quality, and so both using research and doing continuing education is really a prerequisite for, I think, being a good PT over the years. So absolutely, things have changed and changed for the better.
Yeah, I would just to add on to that, that's my experience, is that it's constantly changing. There's new research. There's new there's new things that come out pretty regularly. And the way we treat, if we, for example, someone with an ACL tear, the way that it was done 10 years ago, even 5 years ago potentially, is different now. And so when you graduate, what you'll be doing in 10, 15, 20 years is probably going to look a little bit different than what you learned in school, because there's so much advancement. There's there's change in what we know and what we do. So it's a very dynamic, fluid profession in terms of knowledge and skill acquisition. So yeah, and that's one thing that I do like about it, is learning new things and new discoveries.
I don't have a ton to add since I'm 2 years in. I think their answers were great.
All right. And then our next question is, what's something that you didn't expect going into your field, and that you maybe had to kind of learn from experience? And then I guess if we could, oh,
I think just for me, as a new graduate, you're not going to know everything. And so it's really hard to learn everything that you need to know. DPT school really prepares you to be an entry-level physical therapist, meaning that you kind of know the basic knowledge to be able to safely and effectively treat patients. But to advance and move towards more of that expertise or expert in the field takes a lot of practice, mentorship, learning new things, continuing education. And so for me, just being able, when I graduated, I kind of wanted to be that, to know everything right away. And I kind of took things personally if I didn't know something, but it just takes mentorship and time and practice to once you graduate to come out and be a more effective and efficient physical therapist.
thank you. That was super awesome to listen to. And then for our next question is, I guess, what do you guys think will be the biggest change in the health field, especially in this field, in the next 10 years? Do you think there'll be like an increase in demand? And like, what are your thoughts on that? And then I could direct this question to Dr. Lisa.
Yeah, I do think there will be an increase in demand. We're getting, kind of the full impact of baby boomers and of which I'm kind of at the end of the baby boomers. So we will probably all need some kind of physical therapy. So I think there's good job security in that. But with regard to kind of what's new, what we expect, I think there will be a lot more in the world of kind of robotics and a lot of different types of interventions that really take our expertise to figure out how to use them. But there will be probably a lot more options for things like, having wearable sensors, and we're sending information to our physical therapists about how we move and how much we move, and all those types of things I think are just going to continue to increase. So there will be a pretty high learning curve with technology, but I think a lot of students now are there. So they're getting that, they're learning that, they're understanding that, and that will just increase.
One thing I notice a little bit, at least kind of in the area of outpatient or orthopedic physical therapy, is a little more wellness, or a little more awareness of wellness, lifestyle medicine, preventative health, social determinants of health. I think those seem to be becoming more popular. And so, as a physical therapist, typically someone is injured, in need of rehabilitation, and comes to a physical therapist. But we also have the skills and knowledge to kind of work with those patients on prevention of lifestyle factors, of wellness, and sort of seeing if we can meet some of these patients, maybe before they have their injury or their pain. I think you're also seeing, and this isn't maybe new, but more of a shift into how psychology and how patients perceive and deal with pain, and how the mind can affect a patient's outcome. So not being psychologists necessarily, but just understanding um, psychology and a little bit more of a holistic approach, not just a shoulder injury, but a whole person with lots of things going on in their lives and thoughts and feelings and that kind of thing. So that's not necessarily new, but I think we'll continue to see that. And I would agree with Lisa. We'll definitely see technology being used a lot, possibly telehealth even more, and wearables and things like that to track patients.
So I wanted to direct one of the live questions again to Dr. Sarah is, I guess as a new graduate, do you have, do you know if there's a specific undergrad degree that helps more when getting into graduate school and getting into the field?
No, there is not. As long as you do the prerequisites, they'll admit a really wide variety of degrees. I think subject matter wise, like a kinesiology, it prepares you pretty well for it. Biology even can prepare you pretty well. I was exercise science. So some of those just subject matter, but it's actually really nice having a variety of perspectives in a physical therapy class, having someone with a psychology degree, having someone with a chemistry degree. We had someone with an education degree that just happened to have also these PT prerequisites and decided they wanted to go PT. So I think a variety is good. And Lisa and Adam as faculty members might have an interesting perspective on some of these too.
Sure, I'll go next, and I totally agree with you, Sarah. I think many PT programs are really interested in people who have a lot of variety and a lot of exposure to different aspects of education. So I actually, when I look at applications, I'm really looking at people who have a variety of experience. Certainly that, if kinesiology interests you and that's a direction you want to go, and maybe you've done some help in a research project, things like that, those are great. But we have a lot of people who've been had degrees in music or dance or things like that, that I think just shows kind of a little bit more about who they are. And we're interested in people who have exposure to a lot, and exposure to people who maybe aren't like them, and that kind of experience where you understand maybe a little bit about the disparities in the world, and you're really looking at the world with a broad perspective. I think coming to a PT interview or coming to the program with that kind of background is probably much more important to me than what your degree was.
I would agree with both of those comments from Lisa and Sarah. I agree. I think the degree doesn't necessarily matter. We do have to look at performance. Whatever degree it's in, we have to kind of make sure that you've done well, and that gives us an idea of if students will be successful in the program and be able to pass their board exams. So, but yeah, I think it is interesting to see a variety. I think typically we find that a lot of students, or the majority, tend to be in the exercise science, biology realm, typically because of the application to physical therapy. But it doesn't have to be. If that's your interest, if that's what you like, go for that. But it doesn't have to be, and it does. If you're not in that area, it does show us a little bit of kind of your area of interest, or things outside of just physical therapy or the human body. So I would just agree with what both of them had said.
All right, and then another one of our live questions is, what kinds of continuing education courses have you taken or are interested in taking in the future?
I haven't taken a lot since I am newer. I'm still just figuring out how to apply everything from school. But I've taken some manual therapy courses and some just kind of basic. I took a taping course, some of those different things that we don't really spend as much time with in school. I'm looking forward to taking more like in a conference type of setting where you can get a really wide variety of like 2-hour long lectures on a variety of topics that either the Iowa Physical Therapy Association puts on or the American Physical Therapy Association puts on. So that's my answer.
I would, a couple of courses that I've done recently typically pertain to the area that I practice and teach in. So related to musculoskeletal practice, dry needling is sort of a hot topic right now. You use a little solid monofilament needle to put into the body, put into the skin, potentially to affect trigger points. So treating musculoskeletal conditions. So I've taken some dry needling courses. I've taken a couple courses in lifestyle medicine, which just kind of pertains to prevention and wellness. And then being able to attend just some of the bigger national conferences. There's so much out there. There's just a lot of different areas that you can look into. You know, as a new graduate, you know, I'd kind of recommend that you really kind of explore your options, look at different things that you might be interested in. There's just a lot out there.
Yeah, and even right now, there's a national conference going on online. It's called, it's from our professional association, the American Physical Therapy Association. I would encourage all of you who are interested in PT to go look at the APTA's website. And really, there is so much there, really start to study it. The conference is called the Combined Sections Meeting. And so some of us who have specific specialty areas might belong to what's called a section or an academy. And each of those academies and sections all have their own programming. And so I've been doing some courses in the last couple of weeks. It goes on for the whole month of February, but about mostly related to pediatrics, about balance for children, and actually what Adam was talking about before, kind of this whole area of pain neuroscience is just fascinating to me. I think that's a world that is really moving along. So that's also interesting, and more recent, well, not more recently, but before COVID, I took a course in how to make these little cars for children who have physical disabilities. They're called Go Baby Go cars, and you adapt like a little plastic car for children, and it can be used for children with disabilities. And so those kinds of things are just there are so many, as Adam said. You have to pick and choose what's of interest to you and what will really help your career.
All right, and then I wanted to have Dr. Lisa also start us out with this next question. You specialized in pediatrics, so could you discuss how you got involved in your specialization and how that process was like in choosing, like how your process went in choosing that specific area?
Yeah, I think that's a good question. And most all programs are, as Adam said earlier, kind of educating you to be a generalist. You should be able to graduate and go out and treat anyone of any age range with any condition, knowing that you don't know everything, but you have the basic skills. So what tends to happen is that people come in with ideas. I want to be an maybe do orthopedics or sports medicine because that's what my exposure has been. And then you learn all these new things and you're like, oh, maybe I could do that, or maybe I could do that. Or, and so uh, just learning about it kind of, I think, brings up different kind of directions that you may go in. And then I think a lot of PT students will kind of gravitate towards what they love when they get into the clinic, and that tends to be where a lot of people, if they've spent some time in the clinic in a clinical education experience, like really fall in love with it and may be hired by that facility if they when they graduate. And so I think that specialization really may start in your clinical experience, but it probably will develop as you spend some years in a setting and say, I like this, but maybe I want to try something else. And I think that's the phenomenal part of physical therapy. Is, I mean, I've mostly done pediatrics, but I've done it in a variety of setting. I've worked in school systems. I've worked in early intervention, which is children under the age of 3 and their families. I've worked in outpatient clinic. So there's so much that you can see and try and see what really speaks to you in terms of specialization over the years. And some people, particularly those who may want to work in rural areas, may find that they love kind of the exposure to a little bit of everything, and that's a great way to go as well. I really think those therapists, I'm always amazed at how they may see a 90-year-old and a 2-year-old on the same day, and that's phenomenal work as well.
I would just say, for me personally, there's definitely a lot of stories of people saying, I want to do this when I graduate, and then they end up going in a totally different direction. Common is someone that's an athlete that is really interested in like sports medicine or outpatient, and then they really fall in love with geriatrics or pediatrics or something along those lines. That happens quite regularly. That wasn't me though. I think for me, emotionally, to work with someone with a neurological condition, a spinal cord injury, even if I was to see, a caseload of pediatric patients, for me, there's some emotional, something emotional that would kind of just weigh on me a little bit more than somebody that comes in and has low back pain. Low back pain can be very disabling for some people, can really affect their lives. And so to me, there's something about being in an outpatient orthopedics that I don't know. For me, it just works well with my brain, with my personality type. And some of those patients that are a little bit more involved, maybe in the ICU or the acute care, I think it would just it would be kind of hard on me from an emotional standpoint. I'm not sure why that is, but that's just something I noticed as I worked in some of those different areas. And so I've just found that the area of outpatient orthopedics just kind of suited me a little bit better, my personality. And so as I mentioned before, I was kind of interested in doing a lot of hands-on or manual therapy, which is kind of a subspecialty of orthopedics. And I was kind of interested in that since undergraduate. And then there's avenues, as Sarah mentioned, there's courses you can take, there's post-professional training like residency programs or fellowship programs that you can be involved in if you really want to specialize in a certain area. So that's kind of my experience.
I have a few of my classmates that I know went ahead and just pursued either a residency or a specialty right away. They were extremely passionate about a certain field, and so they went ahead and did that. The majority of them did not, though. I think that is something that can develop as you are a little more experienced in the career and you find your niche. You can go towards that specialty at any point in the career. So it does not have to be something that you choose immediately out of PT school. I have other classmates that have already done 2 or 3 different jobs in a variety of settings just because of differing interests or job market or situation. So you do not have to specialize to be a successful physical therapist. And like Lisa was saying, I think rural healthcare is its own specialty. It's an interesting field. There are days that I see a lot of outpatient orthopedics, but there's days where I see a spinal cord injury, and 95-year-old working on their balance, a 10-year-old with an ankle sprain, a wound that I'm helping to facilitate the healing for. Just a super wide variety. So throughout PT school, I loved everything that we did. So it's a really good fit for me to be able to keep skills in all of those different areas and keep each day different.
Thank you, guys. It looks like we're set to end at 10:50 for this session. So I guess we could probably finish up one quick question. I guess one question is that we'll end the day on is what is some advice that you'd give students that would like to pursue this career and maybe finding their like passion or just any advice through like success for schooling?
I could start. We've all kind of alluded to this throughout this session, but just keep your mind open because physical therapy is a really big field. Like it's a lot bigger than you might think. It's a lot bigger than I thought at your stage. So keep your mind open as you are preparing. Go to a hospital and observe if you have the chance. Go to a home health or a nursing home or some of those things that you might never have heard about before. Go to those things, see the wide variety of PT, and then if you do choose this route and once you're in school, just keep your mind open during all those classes.
Yeah, I would say learn as much as you can about physical therapy and as Sarah says, some places, I know there were questions in the Q&A about observations and because of COVID that those may be more limited, but that doesn't mean that you can't still do some work. So as I mentioned, look at the American Physical Therapy website, look at the Physical Therapy Journal and see what people are writing about, what kind of research is going on. We also were encouraging applicants, if they couldn't do observations, to interview some physical therapists. So, you know, like call Sarah and say, I won't send everybody your way, Sarah, but but you know, can you talk to me like this, kind of these questions that you have. You know, I noticed somebody asked about burnout, and I would say this is a field that may not be as routine as some other fields. That you, if you're feeling burned out or you feel like you have, you know, a routine, do something about it. So try to do some more research, try to talk to other colleagues, try to go to some continuing education. I think the emotional part is probably what Adam talked about. Probably, maybe harder for some people. So kind of know yourself a little bit like Adam does, what works for him. And so when you think about physical therapy, what are you drawn to? Are you drawn to those individuals who may have lifelong conditions and you really want to help them? Or do you do better if you see more quick recovery? So those are some recommendations I would make as you consider this field.
I have
think-
met with some Iowa State students, by the way, exactly what you were describing. Yep.
I would just echo those comments. Just do a lot of research because it is a big commitment, financially, time as well. Talk to a physical therapist. If you know physical therapy students, talk to them. You may not be able to do as much shadowing. The APTA is a great resource. And I would also kind of think about what is your personality type, or what do you enjoy working with people? Are you a social person? Because physical therapy is definitely a social profession. If you don't like interacting with people as much, that might be something to kind of consider. So I would just think about what do you like to do? Are you someone that enjoys routines, 8 to 5? Are you someone that you know just think through kind of your personality and talk to other people and see if it fits from that standpoint as well, would be my recommendation. And then I also think as a someone that deals a little bit with admissions, we also kind of like to see why someone is looking at physical therapy, as opposed to like, why are you interested in physical therapy and not, are you applying just because you're interested in health? Generally, we'd like to know that you're specifically interested in physical therapy, and not just podiatry or occupational therapy or a doctor of medicine. So, and if you can articulate why you're choosing physical therapy, I think is also beneficial.
All right. I want to thank our panelists so much for being here today, especially this early in the morning, for sharing their experiences and their insight. It was really awesome to have you guys with us, and we hope to see you guys again. And then to our students, if you guys are planning to go to the next workshop sessions, then you guys can go back to the website for the links and stuff for the Zooms, and they'll start at about 11. So thank you guys so much.
Thank you, Zena.
Thank you. It was good to be here.